Yeah. Okay, my talk is about the HA130 Hemoperfusion therapeutic evidence in China, the protocol sharing. The first trial is hemoperfusion plus hemodialysis to improve the quality of life in maintenance hemodialysis patients, a prospective randomized controlled multicenter clinical study. And this study starts from 2014 and lasts 4 years. And the results are published in 2019. And this research is multi-center. The lead hospital is Chinese PRA General Hospital, and a total of 37 centers are located in 26 cities of 20 provinces. And the research leader is academician Chen Xiangmei. And this is the experiment design. 400 maintenance hemodialysis patients were randomly divided into 2 groups: low flux hemodialysis group, high flux hemodialysis group, low flood hemodialysis plus hemoperfusion group, and high flux hemodialysis plus hemoperfusion group. Each group contains 100 patients. And what we observed, the parameter includes PTH, beta-2 immunoglobulin, CRP, homocysteine, and also we evaluated index of living quality, skin itch, sleep quality, appetite, and living quality. That is SF-36 scale. And this study follow up to 12 months after treatment. This is the plan of the treatment. The 4 group, LHD group used the low flux dialyzer, hemodialysis for 4 hours, 3 times per week. HHD group, this high flux dialyzer, the same schedule. And the LHD plus HP, the low flux dialyzer plus hemoperfusion, and this is for HP for 2 hours and 1 time per week. 2 hours, 1 time per week. And also this time HD for 2 hours. And low flux dialyzer, this high flux dialysis plus HP for 1 time per week, HP for 2 hours, and this time HD for 2 hours. A high flux dialyzer, that's the routine conditional process. So this is the low flux dialyzer and the high flux dialyzer, the parameters. Let's have a look at the results. Firstly, the change of IPTH. We compare of IPTH changes before and after treatment. We see that this one is high dialysis plus HP, and also low hemodialysis plus HP. They all come to the different significant difference, the down regulation of the IPTH level from 6 months to 12 months. Is significantly a difference. Now, also, this is the point of 12 months, the decrease of the IPTH in the 2 groups. Now, also, okay, Also, beta-2 immunoglobulin changes before and after treatment is the similar trend. But in this case, the 3 group of the beta-2 immunoglobulin downregulated significantly, including high flux dialysis, except the low hemodialysis. This is the beta-2 globulin changes the rate before and after the treatment. Also the same trend. The change of CRP and HCY, the result showed that the change in CRP is in the HP group, 2 HP group, they all downregulated the HCY, and CRP group, it is lower than the control. And also, we have demonstrated the each scan, the changes. We can see the 2 groups containing hemoperfusion, the inch, the score, the score of the skin inch downregulated significantly. And how about the sleep and appetite? We also can see the sleep is improved and the appetite is also improved in HP group, whatever low flux dialysis or high flux dialysis. And about the living quality, we can see SF36 total score as the quality is improved in the HP groups. And how about the adverse events? We can see the 4 groups. Between the 4 groups, the p-value is not significant differences. So AE, SAE, experimental correlated AE, and for example is extra. That is the same. So the first trial and summary is that is about the same as lowering the level of beta-2 immunoglobulin, and the decrease of PTH level was significantly increased, and also improved itching symptoms was significantly enhanced. So this is the first trial from the national 20 province, the multiple center. Next, I would like to introduce talk about the second trial. The second trial was performed in Shanghai city. This is also randomized open label parallel group multi-center study. The title is Efficacy of Hemoperfusion Treatment on Improving the Survival of Maintenance Hemodialysis Patients. So this trial is focusing on the survival. The leader of this study is Professor Zhang Chengru, professor in the Shanghai Jiaotong University School of Medicine. The chart flow is about the 2 weeks run-in period, regular blood purification treatment, and then intervention period lasting 96 weeks. And each point just like this to collect some parameters, some data. Primary endpoint is all-cause mortality, including all-cause mortality and the cardiovascular mortality, and the record time of death and the diagnosed cause of death. A secondary endpoint including cardiovascular mortality, major cardiovascular events, and the quality of life. And this method of the treatment is about 2 to 3 times of a hemoperfusion treatment per week, and 4 to 5 hours each time. And so this is somehow somewhat intensive treatment of hemoperfusion compared to the first trial. And we can see the all-cause deaths, the two groups, we can see to get the lower, significant lower mortality following up the 96 weeks. And all-cause mortality in HP arms start to reduce significantly since 24 weeks. And over time, the mortality gap between the two groups increased gradually. And we also can see that the CV mortality in HP group was significantly lower than that in control. That's up to 37%. Compared with the control, CV mortality in HP group decreased significantly from 24 weeks. Okay, how about the new or recurrent cardiovascular events? This table shows that the new or recurrent CV events in HP group was significantly lower than those in the control group. And after 96 weeks of treatment, the scores of increase of symptoms and discomfort, cognitive function, and social support in HP group were significantly higher than those in control group. The SF-36 life quality score showed that after 96 weeks of treatment, the overall score increase of raw physical body pain and general health, the raw emotion, and the SF-36 in HP group were higher than those in control group. So in this trial, the researcher also have looked at the beta-2 immunoglobulin change. This is beta-2 immunoglobulin in HP group decreased significantly after 48 and 96 weeks of treatment. And the decrease of beta-2 immunoglobulin in HP group was significantly higher than that in control group after 96 weeks of treatment. And also IPTH has the same trend. The difference is very significant between two groups. And about the safety, there was no significant difference in blood routine and liver function and blood lipid and the blood sugar between the two groups before and after treatment. So let's have the conclusion from the second trial. The all-cause mortality rate in the HP group decreased by 37% compared to the control group. In the HP group, the all-cause mortality is 7.53%, while in the control is high as 11.95%. Cardiovascular mortality rate decreased by 37% compared to the control group. And also the newly emerging or emerging cardiovascular events rate in the HP group was significantly lower than those in the control group. And also HP improved discomfort, cognitive function, and the social support than the control group. So we can have a summary regarding above two trials performed in China. The first one is the 2 RCT studies showed that the HA130 hemoperfusion is effective and safe for maintenance hemodialysis patients. And secondly, patients can profit from hemoperfusion, decreasing serum toxins, and life quality improvement. So thank you for attention. That's all. Thank you.